Hey there, it's Dr. Justin Marchegiani, and today's video is going to be on how to have clean skin secrets. Again, your skin is the mirror of your gut. So anytime I see someone's skin and they tell me they're healthy, or I just see someone walking by me at the airport, I know off the bat something deeper is going on, whether it's in their gut, whether it's an infection, foods, overall inflammation. It really gives me a window into what's happening inside the body. Again, we need the gut. It's essential for nutrient absorption, for essential fatty acid absorption. And again, the gut's the barrier between the inside world, inside your body, and the outside world. And essentially, if we are eating foods that are driving inflammation and driving a leaky gut, that's revving up our immune system. Again, 70 to 80% of our immune system is in our gut, is in our intestinal tract. So the more stress that we put on our body food-wise, that's going to be shown to the skin, because the skin is the integumentary system. It's part of the integumentary system, which is a system that helps with detoxification as well. Again, you'll see the skin push out various things if you get a rash or if you eat bad foods. You'll see the skin react in a way because the body will use it as a means to detoxify, especially when the liver and when the stool and the kidneys and such are all at capacity. So digging in deep, you want to have clear skin. There's a couple of things you have to do. In just personal experience, I had terrible skin growing up. I remember going to the dermatologist's office and getting a little handout that you see right on the table, and it says, diet has nothing to do with your skin. And I'm just like, oh, this is great. I can have my pasta and my candy bars and all this, and there's no worries. I don't have to really take responsibility for my life and my diet and my health. And here we are, 15, 20 years later, and I know that to be a total lie, because changing all of those things made a huge difference in my life as well as all of my patients' lives. So again, looking at skin, the first thing we got to look at is food. And we have to look at inflammatory foods. So the first thing that we're going to do anytime we're dealing with someone with skin that's not where you want it to be, right? Not porcelain smooth. We want to get rid of the inflammatory foods. So off the bat, we want to cut out all of the grains. Grains are going to be essential. Grains are one of the most inflammatory foods you could have. We cut out all legumes. We cut out all high sugar fruit. High to medium sugar fruit. Again, your high sugar fruits are going to be your tropical fruits. Typically, just your low sugar fruits are the ones you're going to be eating. Those are like your berries, your grapefruit, your lemon, lime, etc. Next, eggs. Eggs are a really good starting point as well. Eggs are really good for you, but I typically recommend cutting them out for a few weeks if you are having skin issues, and then add them back in. Dairy is a big one, especially with the skin. And again, I know grass-fed butter, things like that are really good fats, and you want them in your diet, but it's probably better off cutting them out for a little bit and then add them back in. Again, the big ones are going to be the yogurt, it's going to be the milk, any processed, refined dairy is going to be a thing you want to pull out. Again, typically ghee and grass-fed, high-quality butter are going to be okay, but for a time being, it may be all right to pull it out. So grains, again, we're talking about corn, legumes, beans, lentils, all high sugar to medium sugar fruits, like I already mentioned, eggs, and dairy. And again, nutrient-dense foods. Well, again, skin's really important. We need good quality fats to bring hydration to the outer surface of the skin. So good fats like olive oil, butter if you can tolerate it, if you pulled it out for a period of time and add it back in, ghee, coconut oil, the many studies looking at fish oil and omega-3 fatty acids. I'll post a couple of study references that I used to do my research on while presenting this information outside of just my clinical information too. So check below for references. So nutrient-dense foods, like I already mentioned, high quality meats, again, organic, grass-fed, all of these things are going to be super important. Quality does matter. Again, vegetables, especially non-starchy, right? Non-starchy are going to be really important, and we'll go over why below. Again, things like liver are amazing, right? Fermented foods can be really helpful because of the good bacteria in the foods. So like a good kombucha may be helpful as well. Again, some kombuchas are really high in sugar. I like the GT Day brand, especially either the Trilogy or the Ginger Aid, because it's only at 2 grams of sugar per serving. And omega-3 fatty acids, like I already mentioned, so we're talking fish oil here. That's a really excellent source off the bat. So food-wise, really important. We want to cut out the inflammatory foods. We want to add in the nutrient-dense foods and really emphasize good fats, because fats bring hydration to the skin. Next, insulin and blood sugar is really important, okay? If you dig into the literature and you type in skin and blood sugar, or hyperglycemia and skin, or low glycemic diets and skin, what you're gonna find is surges of insulin, and insulin surges typically follow blood sugar surge. So you eat some food, right? One of the first things that happens is your blood sugar goes up. And in response to that, your body then surges insulin. Your body surges insulin, and insulin, what that does is it knocks your blood sugar right back down. So as blood sugar comes up, insulin comes up, which then knocks blood sugar right back down. Now in that process, because we're surging blood sugar up and surging insulin up and then dropping blood sugar down, I call this the roller coaster ride here. So this is basically what's happening, right? We have this massive roller coaster ride of blood sugar, and at the top, we have insulin surging, and at the bottom, we have cortisol surging. Insulin at the top, cortisol at the bottom. And what's happening when we oversurge insulin, because we're eating foods that are glycemically inproportional, we are driving these sebaceous glands, these are the glands in our skin, to make something called sebum. And sebum is this oily substance produced by the skin, but what sebum is known to do, so right here, the sebaceous gland, right, we have insulin driving the sebaceous gland to make sebum. Sebum then blocks the pores. So you have this, let's say this is our pore right here. And if we block it with some sebum, what's gonna happen is this is gonna inflame the pore, and we're gonna develop an acne-like cyst or a pimple, if you will. So again, insulin, blood sugar, sebaceous glands, sebum, pore blockage, acne, because the sebum from the sebaceous gland clogs the pore. So really important, we want to dial in the glycemic proportion to the food. That's why I emphasized non-starchy vegetables, lower sugar fruits. And again, if you're more active and you can handle a little bit of starch, that's not a problem. It's really about making sure that we're not causing our insulin to surge. And also we see it in females, especially females that have PCOS. We know it because their testosterone levels are going high because their insulin levels are going high. And you typically see a little bit of peach fuzz on the jawline in your PCOS females, and that's driving the androgens, which are then creating this whole vicious cycle of the sebaceous glands, sebum, pore being clogged, and then the pimple occurring. So detoxification and infections. So really important here, your skin is part of the integumentary system, which is a system for detoxification as well. Kidneys, liver, stool, right? The gut, these are all methods of detoxification. And when they become overwhelmed, the skin then has to kind of rise to the occasion, if you will. So really important. One of the things that we see in a lot of patients that have skin issues is they have a high amount of endotoxins in their blood. And endotoxins are nothing more than metabolites or basically part of gram-negative bacteria. And these are the toxins that are in their outer shell, if you will. So the endotoxins are high in the bloods of people with skin issues. Also, we see SIBO, or small intestinal bacterial overgrowth. This is basically the bacteria in the colon migrating their way back up into the small intestine, and the bacteria in the small intestine are then feeding off them and producing high amounts of methane and or hydrogen, and we see that on a breath test. And again, when we treat these patients with high quality probiotics, one of the things we see is we reduce inflammation, because a lot of these patients right here, they have what's known as dysbiosis, right? We already mentioned that with the endotoxins, if you will. So here's our bacteria, here's our good bacteria, if you will. Here's our bad bacteria, and you can see we want to shift it, right? We want to shift it so the good bacteria is more and the bad bacteria is less. And that's how we shift dysbiosis. Typically, it's the bad is high and the good is low. So we're shifting it so we have more good bacteria and less bad bacteria. That will then decrease the endotoxins, that will decrease the SIBO, and that will help to reduce the inflammation right here, the interleukin-1 alpha, as well as the substance P. These are inflammatory byproducts that when we add in good quality probiotics, it tends to reduce the inflammation. Now, some people, I find they have a hard time taking on probiotics. They become probiotic intolerant, if you will, because their bacteria is so skewed in the bad direction. And what we typically have to do is we have to clean out the weeds before we lay down the seeds. So the probiotics are the seeds and the good bacteria are the weeds. And sometimes we have deeper weeds. We may even have parasites, strong fungal infections, bacterial infections like H. pylori. That's where the endotoxins come in. So this is super, super important that we may have a deeper infection. We have to tend to clean those weeds out, and then we can drop down the seeds, and there tends to be an improvement in skin quality and texture too. So again, this is Dr. J here. When we're looking at skin, we can't just look skin deep. We gotta look deeper past the skin, into the gut, into the diet, into the blood sugar. All is connected. It all plays a major role in overall health and how you look and appear. So next time you look at someone's skin, think about it as a mirror to their gut. Not just a superficial layer, but a mirror to their gut. And if you want to have healthier skin, you got to dig deeper into the gut. So if you have any questions or you need help dealing with this issue with yourself, feel free and click on screen or reach out below so you can get a hold of me. Again, this is Dr. Justin here signing off. Have a great day.